Bismillah ar-Rahman ar-Rahim. I'm Dr. Reem Fathallah, lecturer of internal medicine in diabetes department. Today, inshallah, I'd like to discuss part of cardiology examination, which is percussion of the heart. First of all, we want to know what is the importance of percussion of the heart. It's important for us to detect two important things. First is the dilatation of cardiac chambers or main arteries, and if there is also pericardial effusion. These are the two important things we can detect with cardiac percussion. Let's start how to percuss cardiac borders. First, we want to know that the heart is like this, like a fist. This is the shape of the heart here. There is upper border, or called the base of the heart. There is right border, left border of the heart, and the apex. This is the anatomy of the heart which is present here. How to percuss? First, we will start with percussion of the base of the heart, or the upper border of the heart, called the base of the heart. This is by percussion on right second intercostal space and left second intercostal space. Right second intercostal space called aortic area. Left second intercostal space called pulmonary area. So we will start with percussion of aortic and pulmonary area in the second right and second left intercostal space at the parasternal line. As a rule in percussion, we have to start with the resonant, from the resonant note to detect the dullness. So we will start like that. First, how to know where is the second intercostal space? We have to start with, this is the Lewis angle or sternal angle, like that, moving the index till there is a bony prominence. The bony prominence in the sternum, this is the sternal angle. In front of it, okay, opposite to it, there is the second rib, and below it, this is the second space. So this is the second space, we will start with it. Okay, we will start percussion of the second space like that. Okay, we have to percuss perpendicular way, because there is a rule in percussion, the percussing hand must be parallel to the border. Okay, so we will start percussion, okay, from the lateral to medial. Can you observe? It's resonant note. We will percuss till the sternum. Okay, this is resonant all the way. We will do the same on the left second intercostal space. From outside, from the resonant, to detect if there is dullness. We will start from the mid-axillary line, inside. Can you observe? It is resonant till the sternum. This is the first step, percussion of the base of the heart. Okay. Next step, we will examine the right border of the heart. How to examine the right border of the heart? We will start by examining or by detecting the upper border of the liver by tidal percussion. We know, we all know how to percuss the upper border of the liver by tidal percussion. By the way, all the percussion of the heart are heavy percussion, except percussion in the bare area, we will take it, okay, it's by light percussion. So we will percuss by heavy percussion to detect the upper border of the liver. We will start from the second intercostal space in the mid-clavicular line. Resonant, 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 This is the dullness. Okay, can you observe the change of note? So here the impaired note, okay, or start of dullness. So we have to count. This is the second space, third, fourth, and fifth space. Normally, the upper border of the liver is in the fifth space. Okay? To confirm, you will do tidal percussion. Ask the patient to take his breath and keep it, okay, to hold his breath. خد نفس واحبسه يا يسري. We can observe it is resonant. رجعه تاني. Again, after release the breath, it is again dull. Okay, so this is the first step. After we detect the upper border of the liver, we will complete percussion of the right border of the heart by this way. 2 spaces above the upper border of the liver, wherever it's present in the 5th, 6th, okay? 2 spaces above the upper border of the liver. We percuss, as a rule, from outside, okay, from the mid-clavicular line towards the sternum. Okay, this is the right border of the heart like that. So, normally, it is resonant all the way till the sternum. Normally, the right border is like that, okay? So, it is resonant till the sternum. We will do like that, perpendicular also. In all percussion of the heart, my hand must be perpendicular to the surface of the heart. Okay, it's resonant till the sternum. Okay, the 4th and 3rd space here are resonant till the sternum. This is the normal, okay? If there is dullness or impaired note, it means there is chamber dilatation. Chamber dilatation like what? Like right here, the cause is right atrium enlargement. Okay. I forgot to tell you that impairment or dullness, impaired note or dullness in the aortic and pulmonary area due to what? Dullness in the aortic area due to aortic dilatation or due to systemic hypertension. Dullness in pulmonary area due to pulmonary dilatation or pulmonary hypertension. Okay, this is the cause of dullness in the base of the heart. Now, we finished the right side of the heart, the right border, the base, the right border of the heart. Okay, now we will go to the left side. Okay, the left side of the heart, we said the second intercostal space is resonant normally, which is pulmonary area. What about the third intercostal space? The third intercostal space here, it's called cardiac waist. Cardiac waist may be impaired note, okay? Normally, not more than 1 finger from the sternum, okay? Normally, there is cardiac waist, means the heart is like that here in this position, okay? Cardiac waist, there is impaired note in the third intercostal space, okay? Not more than 1 finger. This is the cardiac waist. Okay, so we will percuss from outside as a rule from to inside. Can you observe? This is here. This is the normal cardiac waist. Resonant, then at this area there is dullness. If there is enlargement of or widening of this dullness in this cardiac waist, it denotes there is left atrial enlargement. Left atrial enlargement. Okay. What about the fourth intercostal space? Here, the fourth and fifth intercostal space in the cardiac examination is called bare area of the heart. It is very important here. Bare area of the heart, okay, in the fourth and fifth intercostal space between the sternum, okay, and the parasternal line. This is the bare area of the heart. What is meant by bare area of the heart? It is the area of the heart not covered by the lung. So, the normal note in this area is impaired or dullness. Okay, impaired note or dullness. This is the bare area of the heart. So we will examine for the bare area of the heart. This is the second, third, fourth. This is the fourth, from outside to inside. Can you observe? Okay. Okay. This is the fifth space. Also, there is dullness in this area. From the sternum to parasternal line in the fourth and fifth space, this is bare area of the heart. Okay. What else in the left? Okay, if it is resonant, what is the abnormality in the bare area? If it's resonant, okay, if there is hyperinflation of the chest. Hyperinflation of the chest, it will be resonant. Okay. What's next on the, this is the left border. Next is the apex of the heart. We know the normal side of the apex of the heart, which is left fifth intercostal space, just inside the mid-clavicular line. Okay, so this is the normal place of the apex. Okay, first we will detect the apex by inspection and palpation. Second, third, fourth, fifth. Here, this is the site of the apex. نعم عن حيدي كده. ارجع تاني. Okay, it's in the fifth space in this place. Okay, inside the mid-clavicular line, it's normal in place. How to percuss the apex? We have to percuss around the apex. If there is dullness around the apex, outside the apex, it means there is pericardial effusion. Okay, so we will percuss from outward towards the apex. From outwards towards the apex. Okay? It must be resonant all around the apex and dull at the apex. This is the apex. It's dull. Okay? But percussion around the apex, it's resonant. Okay, so it must be no dullness outside the apex. This is the normal. If there is dullness outside the apex, it means what? It means there is pericardial effusion. This is about the left side of the heart and the apex. Okay? What's the next step in percussion of the heart? There is what's called direct percussion of the lower third of the sternum. Direct percussion of the lower third of the sternum. Okay, we will percuss directly on the lower third. Normally it is resonant. If it is dull, it denotes right ventricular enlargement. Right ventricular enlargement, okay? Normally it is resonant. Okay, like that. But if it's dull, it denotes right ventricular enlargement. So this is the percussion of the heart, percussion of the upper border of the base of the heart, okay, percussion of the right border of the heart, then percussion of the left border of cardiac waist, also the bare area of the heart, the apex, okay, and then percussion of the lower part of the sternum. And finally, thank you.